clinical practice. We have 3 presenters who have been engaging in projects that are related to clinical care. And so first up, we have Rachel Foote, one of our certificate students. She will be presenting her work engaging with Integrative Touch for Kids, whole child, whole family, whole community wellness model.
Hi everyone. Again, my name is Rachel Foote. I hope you're all doing well and staying healthy. I will be talking about Integrative Touch for Kids, which was my community experience over the past year. I have to thank JC for recommending me to this organization because I have loved it and felt like I've gotten so much out of this. So definitely shout out to JC. Okay, so Integrative Touch for Kids, it's a nonprofit organization and it's based out of Tucson. It was founded by Shay Bider in 2005. Her story was she was a pre-med student and she was shadowing in a hospital and she saw a patient who was about to go into surgery and she noticed they were in a lot of distress and very anxious, and she just felt that someone couldn't be going into surgery with that sort of mindset and in those conditions. So she likes to focus on the whole child in body, mind, heart, and spirit. ITK has grown to be the leader in the field of pediatric medicine, integrative medicine, excuse me. And so their mentality is like whole child, whole family, whole community. So that meaning all parts of the child are so important, and it's also kind of like a holistic approach. So ITK supports families whose children have any type of special health or medical needs. This includes kids with cancers, genetic conditions, autism, cerebral palsy, traumatic stress, and other serious health issues. So what is Integrative Touch? It's a new therapy that was pioneered by Shay, and it reaches 3,500 people in the community and in the hospital setting. So Integrative Touch is a healing framework and hands-on therapeutic approach that allows participants to focus on what they want to heal most in the mind, body, and spirit. So the different modalities that ITK uses is things like energy work or Reiki, massage, reflexology, play, music therapies. And as you can see in the top photo, that's Katie Frazee, the program coordinator, and you can tell they're playing and they're having fun and they're smiling. And then in the bottom photo is Nancy Barber, and it's a lot more of a calm session. She's probably doing Reiki or some sort of energy work to put this patient to sleep and relax them. So results after receiving Integrative Touch, 62% of people see reductions in anxiety, 60% see reductions in pain, and that could be emotional pain and physical pain, and 52% see improvements in the global well-being. And so what was really cool for me was I was actually based in the hospital with the ITK team. So we work out of the Banner Diamond Children's Medical Center right across from campus. I served as a program evaluator with the ITK healing team. And one of my duties, I guess, as a program evaluator was just to document every interaction that's made between an ITK staff member and either the patients, families, or even Banner staff. So what was really cool for me is I had never heard of integrative medicine prior to this internship, and I didn't really know what it entailed, what it looked like. There's so many different modalities. And so I was able to watch healing sessions, and I could see patients, if they were getting treated on, I could see them relax, and I could see the family members relax too, just being able to watch their son or their daughter finally getting a little bit of relief from the pain that they were experiencing. And so another job requirement that I had was collecting consent forms. It was very important that we had consent from both parents and patients. Patients had to be over the age of 18 to be able to sign for themselves. If not, we had to get parent permission. And so that consent form collected a lot of different data that helped us see the background and the demographic of the patients we were seeing. And one question that we have is asking their household income, which they can choose not to answer, but we really like to see the socioeconomic status of the patients and their families so that ITK can apply for grants to fund the program, because it is all free to the families in the hospital. Another thing that I do is collect pre and post-session surveys. And the numbers that I showed earlier of the 62% reduction in anxiety, 60% reduction in pain, those are part of the questions for the survey that I administer. So I ask them these questions, how they're feeling in the last 24 hours. I collect those results, and then their treatment begins. After their treatment is over, I ask them how they're doing now at this point. Has their pain gone down? Are they feeling less stressed, less anxiety? Sometimes the patients are asleep, so I can't even collect post surveys, and I just mark they fell asleep, and that's also a great result too. So that was really cool for me to see, like, hands-on what was benefiting these patients, like what different treatments was working for them. And then lastly, I recorded the different modalities that they used during the treatment. So whether they were using massage techniques or Reiki, emotional support, physical support. And this is so that ITK can produce data that shows the impacts of this program for the children and their families. And so serving as a program evaluator was awesome for me because I was able to be in the hospital setting, which I was so thankful to be in that environment and interacting with not only the ITK team, but nurses and child life specialists. But on the flip side of this, I was also able to work in the ITK office, which is a really great creative place for me. And one thing that I was really excited about was being invited to join in on the podcast for ITK. They're launching their first ever podcast called Conversations on Healing, and Shay Bider is the host, and she's finding healthcare professionals and healers all over the country to interview them and ask what healing is to them and what it looks like in this modern moment. And so I've been really thankful to be invited to be a part of this and help her collect guests and all the different parts that we need to be able to launch, and it will be launching in the spring of 2020. So we're very excited about that. I would like to acknowledge the USAID and Integrative Touch for Kids. And thank you again, JC, for this recommendation.
You are welcome. Any questions for Rachel? Okay, well, keep them in your thoughts for when we have our discussion. And we'll move to our next presenter. We have Jacqueline Larson. She is a medical home intern with the USAID, and she'll be presenting her poster on increasing access to health information for individuals with intellectual and developmental disabilities.
I forgot to unmute, sorry. So yeah, I spent the majority of my internship working on making health information more accessible to individuals with intellectual and developmental disabilities. You know, I think many people can find health information confusing, and I know I've even experienced difficulties understanding some health information. So you can imagine that it may be more difficult to navigate health information for individuals with IDD. So I feel it's important for individuals to be able to make their own healthcare decisions and to be given adequate access to do so. So I believe that the majority of individuals with IDD can make their own healthcare decisions when given the necessary tools and support. And so I worked on making documents for specific information to be adapted by accessibility guidelines set by AUCD and incorporated easy read concepts. So the topics I developed are constipation, strain and sprain, sun safety, fever, and when to stay home. I have one of the documents pictured here on the poster, which is constipation. It was actually the only one that was one page, so it was easy to put on the poster. But so as you can see, the document contains a definition of the topic, description of symptoms, causes, and what to do to help the issue or feel better. It's written in a simple, concise way with images when possible to help patients understand the condition. So my methods for creating the adapted documents consisted of researching guidelines for accessible documents and easy read format. I worked with Dr. Basford to identify the most common topics that came up for patient care at the clinic. And for each of these topics, I researched information and then worked to adapt that information to contain the key points in a simple and concise format. Each of the documents will be entered into the electronic health record system at the clinic under a code. Each one will have a different code, which will allow any of the clinicians easy access to attaching the documents to the visit summary given to patients at the end of the clinic visit. So if a patient comes in with a fever and needs to know more information about this, they can just type in that code and the document on fever will be attached and printed out with it. And so it can be really helpful for individuals to be able to refer to this information after they have left the clinic to know if they need to call the doctor again or, whether or not they're getting better or their symptoms are improving. Yeah, so any questions?
I have a quick question, Jacqueline. So have you had any response from patients who have who've engaged with any of the documents yet?
No, so, well, unless Dr. Basford showed any, but not yet. The majority of this has been done this semester because it actually stemmed from another project that I did last semester, but I found it more cohesive to just focus my poster on this one. And so hopefully, yeah, it would be interesting to find that out, but unfortunately, with COVID, everything's been kind of different. So I don't think all have an opportunity to do so, but yeah. So someone asked, or Julie Armin asked, are there plans to use this information sheets more broadly, such as outside the medical home? So I believe Dr. Basford plans on using some of them for patient education purposes. I'm forgetting the specific title, but to use as education kind of pamphlets to give to, oh yeah, so Dr. Basford says the adulting conference. So possibly to use as education materials in situations such as the adulting conference. Thank you.
Oh no, that'd be great. Yes, thank you. All right. Oh, and we have another comment about possibly sharing with MedCats.
Yeah, I mean, I'm happy to share them with anyone. And hopefully, unfortunately, I won't be able to enter them into the electronic health records, but anyone, any of the physicians or residents who work at the medical home clinic will have access to attach these to their documents or pull them up in the electronic health record system. So, but yeah, I'm happy to share with anyone.
Great, thank you, Jacqueline. And we'll now move on to our last presentation in this topical group. We have Mariana Teposte. She is also medical home intern. And her presentation is Patient Case Study Pathway Toward Long-Term Healthcare Wellness.
Hello, everyone. Can everyone hear me?
Yes.
Okay. Thank you for the thumbs up. So I observed a female patient, mid-50s, with Down syndrome and a medical history of hypothyroidism. Her primary motivation to seek healthcare services was weight loss through diet and exercise. She is a member of the Medical Home Project, and the program allocates case management resources. That's Valerie Mata, in case you guys know her. She's here as well. Hi, Valerie. So we get the management resources within Banner University Medical Center, and it provided me with the opportunity to help her navigate the healthcare system. The patient was known to cancel medical appointments, reschedule, or be a no-show. So in order to understand what became known as medical noncompliance, I set out to investigate the obstacles to her access to healthcare. First, I made sure to support and promote the independence of the patient. I did this by attending in-home visits, attending medical appointments, and sitting down with the patient and discussing her needs on a weekly basis. Next, I tried to integrate her healthcare team by coordinating with a medical home project case manager, medical practitioners, and her behavioral health network. This expanded to include day programs like Artworks, in-home health services, and the Department of Developmental Disabilities. The areas to focus on became more complex over time as one task led to another, and in order to be most effective, I decided to organize my focus on areas that would bring more quality solutions over an extended period of time. I focused on promoting her physical well-being, so that meant concentrating on her weight loss and helping her understand her medications, her emotional well-being by coordinating with her behavioral health medical team, her intellectual well-being by encouraging support and self-sufficiency. And I was glad to see that develop over time. During medical appointments, her communication increased and she was a lot more open with discussing medical issues with her provider. I also focused on occupational wellness, so I was able to help her through a job interview and eventual employment, which is a great success to see in a short amount of time, as well as maintaining social wellness by engaging family and close family friends that she felt comfortable with, discussing medical issues or even trying to get community resources. So by engaging family to jump on board with her healthcare, they were able to support her as well, just by taking her to her appointments or reminding her to take medication or just checking in. So overall, the patient established a great rapport with her primary care physician, the medical home project case manager. She got enrolled in Arizona Long-Term Care Services. That expands her medical health insurance and it provides her more resources. She also gained in-home health nurse services, and she's also pending on a DDD habilitation worker. However, the one thing that I didn't write on the results is that her primary motivation was weight loss, but all of these kind of obstacles to her healthcare access kind of put weight loss to the back burner. But she is enrolled in a weight loss program in the clinic, and she's still working on that as I hear. So, and kind of thinking back on it, I wasn't able to really help her gain services, food security, since a lot of her providers thought that she had access to quality food, like fresh food. And that's expensive. And when you look at people with IDD, sometimes they receive their food from community food banks, or sometimes they choose options that they don't know may be unhealthy. So the results, I'm very pleased that she has increased services, and I'm hoping that her DDD rehabilitation worker will help with dieting as well. So we're just waiting on that, and we hope that she continues to have a long-term healthcare wellness program by following these steps. Thank you.
Thank you, Mariana. There's a question for you in the chat box. What kind of employment did she obtain and where?
Ooh. The Beacon program has employment for some of our IDD population. So she's amongst friends, and she's able to move up the ladder if she does well with her job. Mm-hmm.
Any other questions for Mariana? Or any of our other presenters related to clinical practice and care?
Oh, I do want to say thank you to Dr. Basford and to Valerie Mata. Thank you, Valerie. I saw your chat. These ladies did help support me through this process. This took 2 years, and I'm very happy with the results. And I'm happy that she's continuing to continue this wellness path.
Any questions for other presenters? No? Okay.